The most common possible unwanted trade-off from having liposuction performed are contour irregularities of the skin such as waviness and rippling. There is a certain degree of waviness in every patient undergoing liposuction, but often the patient does not even see it. Here is an example of what a noticeable contour irregularity might look like. Some areas, such as the abdomen and inner thighs, seem to be slightly more prone to contour irregularities. Sometimes these contour irregularities, waves or ripples that look similar to cellulite, can be very noticeable and permanent. On the top photo are irregularities of the left inner thigh. On the bottom photo, the contour irregularities and waviness are on the abdomen.
Your surgeon will try to remove fat evenly. However, this is difficult since the surgery is performed under the skin surface and really not under direct vision. Blood, fluid, and ultimately varying degrees of scar tissue then form under the skin in the months following surgery. Physical pressure on these sites during the healing process can further mold and shape the healing areas into an uneven surface. The degree of these surface irregularities varies, however, and they can be very noticeable.
Infrequently, collections of fluid or blood under the skin may not be absorbed easily by the body and need to be drained by a secondary procedure. Excessive blood loss may lead to a need for blood transfusions and their associated risks. As fat cells are removed from the body, some blood is also removed. The larger the volume of fat, the larger volume of blood that is removed. Larger volume liposuctions are thus usually more dangerous because of the associated blood loss and fluid shifts within the body. Very careful scrutiny before and after surgery will reveal asymmetry in everyone. Sometimes this asymmetry is even more noticeable following your procedure. Although the incisions are usually small to allow suctioning, they can heal unpredictably, resulting in varying degrees of scarring.
Here is an example of a good scar which is difficult to see on the leg in the top photo, and a much more noticeable scar in the same location on the leg in the bottom photo. The choice of incision and scar location varies greatly among surgeons, but this could impact your ability to feel comfortable in certain clothes.
It is common to have some degree of numbness in the skin over the area that was suctioned. This is usually temporary, but could cause prolonged discomfort and/or be permanent. In some cases, the skin overlying the area can become pigmented or a different shade of color. Again, although usually temporary, this could be permanent. Infection or traumatic compromise of the blood supply can lead to a delayed healing or even patches of skin loss in the rarest of circumstances. Very rarely, embolization can occur, as fat particles or blood clots that develop enter the bloodstream and ultimately the lungs. Shock or death could occur. Fortunately, this is extremely rare. Liposuction is done routinely without incident every day and is generally a safe procedure. Complications requiring revisional surgery, hospitalization, or causing permanent deformities do occur occasionally, however. Fortunately, the most severe complications are the rarest. They seem to be more often associated with patients with health problems and large volume suctioning. There are certainly other risks that could occur, and the rate and severity vary with different surgeons and their experience. You should discuss all these issues with your plastic surgeon. Related financial obligations should also be discussed prior to surgery with your doctor in case further surgery or hospitalization is necessary. Patients undergoing liposuction in the same area for the second or third time often have a higher risk of complications. Scar tissue from the previous liposuction is now underneath the skin, and the architecture of the tissue has changed. Generally, there is more bleeding, the risks are higher, and the tissue heals more unpredictably. The operating time varies with surgeon, technique, and volume removed. Liposuction can be safely and effectively performed under general or local anesthesia. Your surgeon will be able to decide what is most appropriate in your unique situation and what he or she is comfortable with. Post-operative instructions also vary from office to office. Generally, however, your activity will be restricted for some time. Follow-up visits will be necessary to monitor the healing process, take out sutures, and watch for any signs of complications. Following surgery, your surgeon will probably have you wear some type of compression garment or girdle to help reduce the swelling and bruising. Often this is for 2 to 6 weeks depending on their preference. This is an example of the type of garment that might be used. It can generally be concealed under clothing. The recovery period is variable, and you should ask your surgeon to help you estimate your postoperative downtime and needs. The amount of time you will need to take off work or from normal activities and degree of postoperative discomfort depends on the individual's pain tolerance and the volume and location of fat suction. Large volume liposuction patients usually need longer to recover. The pain is generally well controlled with oral pain medications. Patients are often back at a desk job within 1 to 2 weeks and back to the gym in 1 to 2 months. During the first week generally, sutures may be removed and swelling, bruising, and discomfort are at their peak. In most cases, bruising, if present, and the majority of the discomfort should be resolving several weeks after surgery. Sometimes it may take longer. Following your procedure, you should notice a definite decrease in size in the area that was suctioned. However, invariably, there is still quite a bit of associated swelling from the procedure. After several weeks, you will notice that the swelling is improving quite rapidly, and by 4 to 6 weeks, there should be a marked reduction in volume of the suctioned area. Over the next several months, you should continue to slowly heal. The swelling should continue to decrease. During this postoperative period, it is common to feel hard areas under the skin, tightness, numbness, and soreness in the areas that were suctioned. Blood collects under the skin, and hard indurated areas can be noted, along with associated swelling and asymmetry. You will not be able to estimate the final result until approximately 6 months after your surgery. Because of the postoperative swelling associated with the trauma from the procedure, as well as the fluid that is injected, you might even weigh more after the surgery. This fluid or water weight usually rapidly goes away. Don't expect a large loss of weight from the procedure. For every liter of fat removed, you may lose approximately 1 to 2 pounds. Be careful not to eat excessively or develop unhealthy eating habits while you are recovering and less active.
The next video segment follows the pre- and postoperative course of a patient who will undergo liposuction.